You're watching The Wellness Hour. I'm Randy Alvarez. We're back. We're here with board-certified pulmonologist, Dr. Cedric Rutland, and we're talking about what you need to know once you've been diagnosed with lung cancer. So what, I guess you stage the cancer. I mean, what do people need to know? Like what's going to happen first, second, third?
So again, with lung cancer, we have to stage it. So we get the CAT scan. If the CAT scan shows us that you have a nodule that's over 1 centimeter in size, the way that the cancer spreads is it spreads through a roadway system called the lymph system or lymph nodes. This is what the cells that fight infection use to get all over your body. Cancer cells take advantage of that to get all over your body. And so they drain in certain areas, and we stage cancers based on where the cancer cells are present in those areas. So there's certain procedures that I perform that will give me a stage in terms of somebody's lung cancer. One procedure is called Endo bronchial ultrasound with biopsy. What does that mean? So, patient goes to sleep, you take a scope, you go through their mouth into their lung. On that scope, there's an ultrasound probe. Now again, if you have a wife or you've been in any kind of sonogram, that's an ultrasound. This ultrasound probe will go and find the lymph node. And yeah, that takes some skill.
And you're looking at it on a monitor.
I'm looking in their lung, and I'm looking at the ultrasound simultaneously. And I know the difference between a lymph node and a blood vessel. And I'll go to certain lymph nodes within your body, within your mediastinum, which is your chest area here, and I'll biopsy lymph nodes to stage lung cancer, because that is what gives the patient a prognosis, and it's what indicates certain therapies for certain patients. So generally speaking, after an EBUS is performed, I'm in direct communication with an oncologist or a cancer doctor. And I'll say to the oncologist, and our lingo is, hey, station 7 was positive for lung cancer, which puts somebody at like a stage 3, or I'll say station 10 was positive for lung cancer, which may more likely be a stage 2 or a stage 1B. And when we're talking our lingo and speaking back and forth to one another, what we're really coming up with is a treatment plan for that specific patient.
Okay.
Now, beforehand, when we were talking about nodules, the way that you can diagnose lung nodules, you really have two options. One, the radiologist can go from the back and get into the nodule and biopsy it that way. Or two, you can use a navigational system that's called superdimension, in which you would go through the lung the same way I do with an EBUS. You use that navigational system to get to that nodule, and you biopsy the nodule directly that way. And that has its advantages as well, because not only can you biopsy the nodule, but you can also mark where it is for a surgeon to take it out.
Okay, so it's less downtime during the surgery.
Yeah.
Things like that.
Exactly.
And
exactly right.
So what happens? Okay, so if it's stage 1, what are the therapies? If it's stage 2 or 3, what are the therapies?
Generally speaking, stage 1 and 2, surgery, best outcomes, period.
Okay.
Well, I want to do everything I can to make sure my patient goes to surgery. Stages 3 and 4, chemotherapy, radiation. Stage 4, more palliative chemotherapy.
Now, what about some of the technologies like these beams, like a proton?
So that's the radiation therapy.
Yeah.
So what that does is it calms down the cancer growth. So the cancer cells are really growing rapidly. And what the beam does is it just calms down the cancer growth. Now, people say, well, why can't we just have radiation? If you have cancer in multiple spots in your lungs, again, we cannot protect other organs that well. When you're radiating a lung, you're going to get a little bit of the esophagus, which can cause inflammation. You're going to get a little bit of the heart, which can cause inflammation. You want to be able to just get one spot. So it's better if it's just in one spot.
If everything goes right, so that way people watching this interview, if it's a stage 1, what's from day 1 of diagnosis, how soon until they're done with their treatments?
So I can tell you that my mother-in-law was done in 4 weeks.
So 4 weeks from beginning to end.
She got diagnosed. We took her through some testing. We cut the nodule out or the mass out, and she was done because it was stage 1. No chemotherapy.
And what's the downtime like on that?
So she was in bed in the hospital for 4 days. She was at home week for probably another 4 to 5 days, and then over the course of the month, because she quit smoking as well, she improved.
And is this true? I read somewhere that most lung nodules are caught incidentally, like car accident or an X-ray. Is that true?
Yeah, somebody will come in with a trauma, and we'll get CAT scans of their entire body, and we call them incidentalomas, and they need to be worked up from there.
Is that right? And those save people's lives all the time?
They can. They can diagnose things early.
Okay, good. So what's your advice? Final message then to somebody that has all the symptoms, take advantage of the early screening?
Take advantage of the early screening. If you smoked for 30 years, you got a pack a day for 50, or 2 packs a day for 15 years, or you smoked for 30 years, go to your physician, and I recommend you ask him to send you for lung cancer screening.